Happy Monday morning. Good morning. Good morning. Good morning. It may not be Monday morning when you see this. However, it's Monday morning, and this is Monday Mornings with Faye. This is when I will talk about something Medicare that can help both Medicare beneficiaries and Medicare insurance professionals. This morning's topic is about Medicare Part B, B for boy. I'm Faye and I sell Medicare plans. Part B is the medical piece of Medicare. When anyone receives their Medicare card, it has Part A and Part B. It may not have Part B if you have decided as the Medicare beneficiary that you do not want to pay for the Part B. Part B has a standard premium amount that's determined every year by the Social Security Department through Medicare. Medicare actually has that premium established, and you may pay it or you may not. There are several ways that you may not be paying Medicare Part B premium. One of those is, of course, if your incomes are limited and your assets are limited and you're at a certain level, you may have what's called Medicare Savings Program through your state. And therefore, they are paying that actual Medicare premium for you. Then you may have a Medicare Advantage plan, which actually reimburses you a portion or most of the Medicare Part B premium. So in your Social Security check or however you're receiving it, you would not see the difference in your check with Part B premium being deducted because through the plan that you have, you may be receiving part of that back. Each time there is an adjustment to Part B one way or the other, either you are paying it, someone else like the state is paying it and they're no longer paying it, you change insurance programs and the new plan that you have does not reimburse a portion of it, then you will receive a letter from Social Security that says, this is your Part B premium, and this is what needs to be paid. And if there is a retroactive amount because the premium that was being paid has stopped a few months ago, then you will get a letter that gives you an adjustment for future payments because that Part B premium needs to be paid. So Part B helps to cover medical services like doctor's office services, outpatient care, other medical services that aren't covered under Part A. But Part B, because there is a premium for you, it's optional. Part B helps to pay for covered medical services and items that are only medically necessary. So some of those things would include also lab tests, screening shots, and preventive services. Your screening shots and your preventive services, in most cases, are going to have no insurance copay or share of cost from you. Preventive services that are approved and covered by Medicare are actually ones that you will receive through your primary care or through your medical sources without paying a share of cost. If you are in a position where you feel that you qualify to get assistance with your Medicare Part B premium, contact the Social Security Department or your state Medicaid office to find out if you do qualify for assistance with that. If you received your Medicare and You handbook, there's information in the Medicare and You handbook about how you might be able to get help. Now, I'm telling you that Part B is optional. I'm also telling you that Part B has a premium, and that's why it's optional. But I am not suggesting, I want to make it clear, I am not suggesting that you do not have Part B. I am not suggesting that you elect or select not to have Part B. If you do not have Medicare Part B, then those medical services that I outlined, those outpatient care services, your doctor's office visits, your lab tests, those things are not covered. So you don't have coverage for things like surgeries, any exams that where you need x-rays. Those are outpatient services, outpatient medical services. And those are the services that you're not going to have coverage for. So clearly, if you don't take anything away today except the fact that, yes, Part B is optional. However, I am not suggesting that you choose not to have Part B. I am strongly suggesting that you have Part B and you look for the ways to get assistance with it if you feel that you're not able to actually pay the annual premium for Part B. Now, let's assume that you have both Parts A, which we covered before, and Part B. Part B, aside from the monthly premium cost for Part B to Medicare, you also have an annual deductible. The annual deductible for 2024 is $240. So that means that the first $240 of those outpatient medical services, you will pay out of pocket based on the Medicare allowable amount. And then if you have nothing else but Medicare Part A and Medicare Part B through Medicare pays 80% of the covered Medicare expenses, and then you're responsible for 20%. This brings me to the conclusion of this segment, which was to let you know what is Part B, how do you get Part B, what does it cost, and strongly urge you to have Part B and seek those methods of where you might go to find out if you can get help with paying Part B. The next episode, we will talk about Part D. D for David, D for dog. And this is Faye, and I sell Medicare plans. Have a great rest of your week.